Good afternoon.
Hello.
Good afternoon. Just because it's not shining, your garden will be beautiful. For those of you I've not met yet, I'm Dr. Leanne Schluter. I'm clinic owner here at Greenwood Family Chiropractic. I know it's not every day when you start off in a doctor's office that you start off in a group setting, though the initial information is the same for everyone. It's just designed to save time. We won't share any personal private information through here. What will happen is we'll break off, individually go through x-rays, recommendations, any sort of questions. Often by this point, people will ask me what got me into chiropractic care. And I was just a really sick kid growing up. So whether it be from antibiotics multiple times a year, strep throat, bronchitis, sinus infections, ear infections, I had asthma. So not only was I on an albuterol inhaler, I was also on an inhalable steroid. So at the age of 8 years old, every morning when I got up, I had to take a puff of my albuterol inhaler and an inhalable steroid. So at 8 years old, I inhaled a crushed up steroid every morning so that I could play soccer and be with kids my age. As well as I had seasonal allergies, so like you name it, Zyrtec D eye drops, nasal spray. Fast forward, the first time I was ever under regular chiropractic care was when I was a student in chiropractic school. Had looked back more retrospectively to realize I hadn't taken a puff of my albuterol inhaler, not one antibiotic, and all of the over-the-counter allergy medication had expired. Realized at that point, like, maybe this chiropractic thing was onto something. From there, traveled throughout the country studying under some of the top doctors. Between myself and the fellow doctors in the office, we have over a decade alone in just postgraduate training, which is one of the reasons why we have patients that drive from all over the state: Greenfield, Mooresville, Kokomo, Terre Haute, Columbus, Pendleton. Today, 3 very simple but very important things. We're gonna talk about the top 2 disease killers in the United States, #1 killer that's not a disease, and then x-rays, normal and abnormal. That way when we break off and you see your x-rays, you'll understand how that shifting can cause, whether it be headaches, neck pain, back pain, but how that can actually lead to the top 2 disease killers. Which probably makes no sense right now when I tell you that your bad back may lead to disease, though I guarantee you by the time we break off and see your x-rays, you'll have more knowledge about the foundation between the two. Right, because think about this, if I ask you what is the one system that controls every single function inside of the human body, it's the what? Nervous. Yeah, this is the interactive portion through here. 2 reasons why. 1, research finds the more you interact, you actually retain and use 60% more of that information, which is why church have notes now. Secondary component is just honestly like the faster that you answer, the faster you get to see your x-rays. So yes, the one system that controls every function is the nervous system. Yeah, so your brain and spinal cord are what control everything. Your brain has to communicate those messages down through the spinal cord, out along those nerves, regardless. So for your heart to beat, for your lungs to breathe, for your stomach to digest, every single message has to be communicated uninterrupted. Though imagine this. Imagine I take a pair of scissors and I cut the nerve that goes to your heart. What happens? Yeah, your heart stops, you die. Fact or belief? Let's talk. Do you die when no one was confident in that answer at all. Do you die when your heart stops or when your brain stops?
Brain.
Yes, sometimes people think heart, but you can stop the heart, take it out, put in another one, reconnect those nerves. It's what a heart transplant is. Same accord, if I'm brain dead, you get my heart, a lung, a kidney, and you reattach, you reconnect that power and potential, and it literally gives that dead organ life. So instead of cutting that, what if I just take these bones at the base and I shift them and I crush the nerve root that goes out to the heart? And I leave that there over time. Over time, is that heart going to build more health, or is that heart going to build more disease? And sometimes it's hard to understand what it would be like to physically cut a nerve to an organ. When I was training out in Dallas, I had a patient, her name was Rachel. Rachel's mom didn't want to be pregnant with her, so while she was pregnant, she didn't do things right, so Rachel didn't form right. Organs were all flip-flopped, her intestines were in 3 pieces. So her doctor called it her Humpty Dumpty surgery, because what they did is they took everything out, they put everything back together again. And a couple of days after surgery, she said, I don't really feel well. And they're like, yeah. I mean, because we took out every single one of your organs. About 5 days later, they finally went in to do exploratory surgery. And what they found was that her stomach was completely shriveled up, black and rotted. Doctor said it almost looked like a raisin. All right, well, at that point, you've got to figure out more what's going on. So I want you to pay attention right up through here. So you see this dark nerve? That is your vagus nerve, your 10th cranial nerve. It's part of your autonomic nervous system. So just think autonomic, automatic. Because when you go to bed, heart's still beating, lungs still breathing, stomach is still digesting. They accidentally cut that branch of the vagus nerve that went out to the stomach. They physically had to take out her stomach. They gave her a feeding tube into her small intestines, gave her 2 months to live. She owed the hospital over $2 million. I think if you physically cut a nerve that goes out to the organ, it rots, it dies. So what if we just scale that off and pinch that off and you leave that there over time? You've got to think about what's more slowly happening over the course of time. Because really when we talk about disease inside of the body, we have to look at what the top 2 disease killers are in the United States. Any ideas? Yeah, heart disease. I don't have another good one. Heart disease is one. The other one has a lot of different categories. Diabetes is 4th. Cancer. Heart disease and cancer. On average, those 2 affect 5 out of 6 Americans, which do you know that number is closer to 1 in 20 in almost every single other country in the world. Though think about this, as the average American, when we get out of bed in the morning, we typically judge our health by how we what? Yeah, rock hard abs, doing pretty good. How else? How we feel, right? Like if we wake up without an ache or pain, we're like, we're doing pretty good. Though the problem with that, though, if we're gonna judge health on feel, then we've got to take a step back and evaluate then what do the top 2 disease killers look and feel like? What does heart disease feel like? Can you feel good enough cancer? So we never judge health on feel, because realistically, if you're the person who wakes up and feels great, we always think what? Never gonna be me. Though look at this, though, more than heart disease, more than cancer, the number 1 killer in the United States that's not a disease.
Obesity?
Ooh, that's a good one. In like 2012, 2013, they moved obesity into the disease category.
Did they? Okay, I didn't know.
Yeah, it's a good one. Oftentimes people want to say car accidents because people in Greenwood are really bad drivers. Which I feel like says a lot since I was born and raised in Chicago area. I'll give you a hint. Oftentimes you'll see commercials on television for them. People have full cabinets in their bathroom dedicated to it.
Prescription medication.
Medicine overall, iatrogenic deaths, lots of different categories like hospital errors, just alone at properly prescribed, properly taken prescription medication kills 430,000 people every single year. Though, can we all agree, medicine has a time and a place. But you look at something like blood pressure, cholesterol, thyroid, pain. How long were you on those medications for?
Life.
Yep. So look, we established if you take these bones and you shift them and you crush the nerve that goes out to the heart, that heart builds what? Health or disease? Heart disease, right? Symptom of heart disease, blood pressure goes up. But we're like, we've got that, no big deal, right? Take the pill, sprinkle it on there, blood pressure goes down. But every day that the damage stays here, guess what's building inside of the heart? Because when you go off that medication, guess what happens? Does it ever really get down to the root cause of the problem? People always wonder why being here would help with something like blood pressure, but University of Chicago, Journal of Human Hypertension, did a peer-reviewed research study, 2007, found a specific adjustment to this top bone actually lowers blood pressure better than 2 medications combined, HCTC and lisinopril. Why? Well, because it lets the brain communicate out to where it needs to go. See, when we judge health, we fail to realize that of all the nerves in our body, only 7% actually feel pain, 93 are function, which should make sense because did anyone have to tell their stomach to produce hydrochloric acid this morning? Or their pancreas to regulate their insulin after lunch? Look, it makes sense though. The nerves in the base right through here, shoulders, elbows, down to the tips of the fingers, or more importantly, the nerves that go right out to the heart and the lungs. Think about it. Heart attack, what's typically the first sign? Shoulder pain, hands go numb, right? Some people are like, my shoulder aches and my hands go numb. But it's only when I sleep, so it's not a big deal. Nerves in the lower back, ones that run down to the hips, knees, tips of the toes. If anyone's ever experienced sciatic pain, you know what I'm talking about? Or the nerves that exit here that go out to all your digestion, reproduction, gallbladder, and prostate. Symptoms are our body's warning sign. Imagine I'm driving home and I see my check engine light go on, so clearly, as a female chiropractor, I know exactly what to do. So I take a little shiny piece of duct tape and I just plop it right over my check engine light. Inevitably, what's gonna happen to my car? But look, was it ever the check engine light that was the problem? It was a warning sign there was something underlying going on. I truly believe that symptoms are our biggest blessing because there's no other way for our body to tell us and allow us to know, hey, there's something else underlying going on. Does anyone ever really do that with their car? So why do we keep doing it with our health? And a patient, she started care, she was 64 years old the day she started it. And I asked her, I said, what's the number one most important thing in your life? She said, my husband, my kids, my grandkids, my job. Fair. Got her adjusted. She got worse and worse and worse. And again, medicine has a time and a place. Referred her out, they did a scan. They found cancer in almost every single organ throughout her body. And so you look at that exact moment in time, guess what moved to become the number one top priority in her life? You know, when you have your health, you don't think much about it. And when you don't have it, you will go to the ends of the earth to get it. From the day that she got diagnosed, from the day that she passed, ended up being 10 days. And so you think about, yeah, like she wasn't worried about the car she was driving, the house that they lived in. They were trying to plan a huge family vacation. It takes a secondary when you lose your health. I used to have a file folder, and every time I'd run across like a research article or a statistic, I'd throw it in there. But here's what I will share with you more candidly that over a decade in practice has taught me, is that when you lose your health, it affects you as an individual. But when you lose your health, your whole entire world changes. Your time with family looks different. Vacations look different. Weekends look different. Just figuring out, like we can all agree health is important, right? So then where does it come from? So the World Health Organization defines your body's health. I don't think I'll encroach too much on your space. The World Health Organization defines your body's health as your body's ability to heal and function at 100%, not just merely the absence of sickness or disease. Right? Your body's ability to heal and function at 100%, not just merely the absence of sickness or disease. The root word inside health is what? So it controls all healing inside of the body. Central nervous system. Yep, formed 10 days after conception, before most moms even know that they're pregnant. Why? Because this is the system that creates every single living cell inside of our body. So in order for that function to be at 100%, your spine has to be straight from the front, 3 curves from the side. This is just very simply page 2 out of Gray's Anatomy and Physiology textbook. Think about this. You can go to any medical doctor, orthopedic, neurologist in the world, and if your spine looks like this, he's going to tell you that you're healthy or sick. Think there's a reason why we do this test in school. It's an evaluation for a scoliosis. Why? Because research finds if you have a scoliosis, it can take up to 14 years off of your life. Because of pain? Because you're compressing nerves, which inevitably go where? Yeah, and that's where I get to feel people are like, yeah, but like, I do a lot of things right. I eat right, I exercise. You look at someone, Bob Harper, biggest loser trainer, right? Like picture of health, had a massive heart attack in his mid-50s. Or we have the people at the far other end of the spectrum, the ones that do everything wrong. They smoke, they drink, they never work out, but yet are somehow seemingly flawless in health. Everyone has like the weird crazy Uncle Eddie at Christmas parties, and you're like, how has he not died yet? Well, look, our diet and exercise is an aspect of health. Absolutely, but if I cut the nerve that goes up to your stomach, does it matter how organic your vegetables are or how great your supplements can be? This through here is one of the most important views, right? So neurologists consider this the arc of life. So base of the skull, back of the jaw. See these teeth through here? This top bone, C1, your atlas, needs to be like an airplane taking off. This curvature on average needs to be between 43 to 63 degrees. Okay, that's a really important number, 43 to 63. Now, often individuals will ask what the difference is between x-rays and MRIs. X-rays look at bone, MRI looks at soft tissue. On your x-rays, you need to see these nice square bones. Now, in between the bones are your discs. But when you look on your x-rays, you can't see the disc because they're soft tissue, right? So these spaces are disc. We know if there's a compromise with the space, there's a compromise with the disc. Make sense? Directly behind the bones, this is where your spinal cord runs. But again, on x-rays, you can't see your spinal cord because it's soft tissue. Though we know if there's a compromise with that curve, there's a compromise with the cord, which is what you can see here. Can everyone see that loss of curvature? Takes those bones, shoves them back in the spinal cord, compresses those nerves. Now, often people will ask, and it's a fair question, how would my spine ever get like this? And across the board, pretty candidly, for the most part, we have no idea. There are, right, not helpful, but there are hundreds of different reasons how your spine can get like this. Do you guys know one trauma we've all had to go through to get here today?
Birth.
We birth on our backs against gravity. We use forceps, suctions. We break clavicles. Growing up, learning to walk, you fall over 2,000 times on your bottom learning to walk. Falls from monkey bars, roller skating, ice skating, cheerleading, gymnastics, football, wrestling. Slips and falls don't come as easy. We have motor vehicle accidents.
Sledding.
Yeah, right, all the things. Lifting up super heavy weights. Or what I see so much of now too are repetitive micro traumas. Texting, typing, studying, driving, finance, right? Like our spines are like wire hangers. So hundreds of different reasons how our spine can get like this. What we want to see more so is how long it's been in there. We're able to look at that through the different phases of degeneration. So there's 3 phases. First is phase 1. Most obvious difference between normal and phase 1, can you see, is that loss of curvature? So pay attention how that top bone is flat. If you see on your x-rays that your top bone is flat, see when it causes ringing around the brainstem, as if you were to wring out a rag. Often people say, like, why do you adjust me through here if my problems are down here? You guys remember Christopher Reeves, the old Superman? When he fell, he broke C1. So can this bone have an effect all the way down? But remember this vagus nerve. After his fall, his heart started to shut down. So they had him on a pacemaker, a respirator, a colostomy bag. They literally had to push on his bowels in order to make him go to the bathroom. We'll think, was that ever really an organ system problem? It was a nerve that went out there. I had a couple patients allow me to share their x-rays as examples. First one I chose was Shelly. Shelly saw a chiropractor for 10 years. Once a month, very faithfully, insurance gave her 12 visits. And so if you see a chiropractor for 10 years, what do you think your spine should look like? Pretty good. She had a friend who was a patient here, and she was like, hey, why don't you just come check out my chiropractor, see what they do. It's a little bit different, right? So we took x-rays, and this is her neck. Curved or straight? Curved or straight? Okay, I just want to, I'm a little bit nervous. Top bone is flat, causes that ringing. All the nerves that go back up into the head. Cloth over the eyes, stick to the stomach, hope and pray by the time she gets up in the morning that her headaches go away. But she's a school teacher, it's hard for her to go to class. She also had numbness and tingling, which is your body's biggest warning sign. It's literally saying, I don't want to feel it anymore. She also had hand weakness. Now this is where I get a lot of people who are like, Dr. Leanne, this sounds really nice, but mine's different because mine is just muscle. So let's talk. So every muscle you have has a nerve innervation. Basically means every muscle you have has a nerve that goes to it and it controls it. Guys ever hear of the gentleman that goes by Peyton Manning? I like that with that analogy. Most people don't realize that he had 3 surgical fusions to the base of his neck. So he wrote dozens of articles talking about how he suffered with tricep atrophy. Well, do you think he had just muscle weakness when he was in the middle of the NFL? Winning Super Bowls like every other weekend? Problem is the damage on the nerve root that went out to the muscle. It's not a muscle problem, it's a nerve that goes out to the muscle problem. If you take these bones and shove them back, you compress a nerve, right? Well, if you compress a nerve that goes up to the organ, that organ doesn't function better or worse. Tired, fatigued, couldn't stop gaining weight. If she could make it to class without a migraine, by the time she got home, she's like, I don't feel good, I'm exhausted, I just want to lay down. Now, this is where we're very different. We talk about our specialty in terms of structural correction versus what the average person knows as more kind of the pain-based chiropractic. Our specialty is somewhat similar to braces. So imagine you have braces, you tighten, 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 and at the end you have really nice straight teeth. Your braces come off and they give you your retainer. Yep, and you pop in that retainer every now and again, because if you fail to wear that retainer, guess what happens to the structure of your teeth? It regresses back. Now, parallel that to corrective chiropractic care. Ladies, you will get this more. Do you ever try to part your hair different? No, because it's awful. Because your spine, or your hair has muscle memory. Your spine has 10 times more muscle memory than your hair does. So in the beginning, you only hold your adjustment for about a day, and the muscles try to pull it right back out of alignment. So when you look at the different pre and post adjustment therapies, the different adjusting styles, as well, we'll give you all of these therapies to take home with you. That way you can be proactive, not only here in the office, but at home as well. We still have to see you more in the beginning. So with Shelly, we started off at 3 times a week, different checkpoints, and at the end, what we do is we take another set of x-rays. I think we said from the very beginning, we don't judge health on feel. So imagine she might see relief in her migraine headaches after 4 visits. Though if we were to re-x-ray her after just 4 visits, guess what her spine's gonna look like? So guess what comes right back? So at this point, when we start to see the structure change, we move you down into maintenance, similar to the retainer phase. So that structure doesn't regress all the way back. This is where people get really concerned, because they're like, wait, so does that mean that you're the chiropractor that thinks I need to be adjusted for the rest of my life? Yes, 100%, that is my recommendation. But know this about our office too, like we want you to eat well for the rest of your life. We hope that you exercise for the rest of your life. Like our goal is to be alongside as we get well and stay well for the rest of your life. Though that being said, everyone in here is an adult. It's your health, so it's your choice. So with Shelly, we started off at 3 times a week, different checkpoints. This is after her second set of x-rays, after about 7 months. No more migraine, able to get the feeling back into her hands, completely got off all of her thyroid medication. Now that being said, we don't put you on medication, we won't take you off medication. But why wouldn't it make more sense to get down to the root cause of the problem so it isn't something that you have to continue to keep worrying about for the rest of your life? Because you look at in which terms her body's functioning better, healing better. Now, unfortunately, after phase 1 comes phase 2. So research finds if you have degeneration, it continues at about 2 to 3% a year. I'm going to show you in the neck, though this applies anywhere throughout the spine, right? So you should have this curve. So all that force and stress of gravity is on the back of the bodies. It's where it should be. Though now say you lose that curve. Now where is that force and stress of gravity? On the front, right? And so our bodies are really smart. This is not stable. So what it does is it throws bone there. It's not healthy bone. It's sick, degenerative bone. See these hooks that are coming out? So if you ever hear of terminology like bone spurs, osteophytes, so you see how you don't see the nice open spaces for the disc any longer? So this is actually a law. It's Wolff's Law. The law is if you have unequal stress and pressure on a joint, the joint changes. People understand this law much more with lower extremities, like hips and knees, right? Imagine you go to the doctor because your knee hurts. And they're like, well, yeah, because you have arthritis. And, okay, but what's your arthritis from? And they're like, oh, very simple, old age. But then my question is, if it's from old age, how come you have arthritis in this knee and not that knee? Because realistically, how old is that knee compared to that knee? Right, but if you have that unequal wear and tear, that joint wears faster. That law is what applies to the spine. Terminology you'll hear, osteoarthritis, disc degeneration, joint degeneration. I'll oftentimes hear people and they're like, my mom had it, so I'll have it too. That's not how this works. This is wear and tear. Because guess what happens when you start to restore that structure? Now where is that force and stress of gravity? On the back. So it stops the progression of degeneration. Are we ever going to get a spine like this look 100% normal? But we can try to stabilize it so it doesn't progress into phase 3. Look how withered and tethered this cord is. Who has more symptoms, phase 1 or phase 3? Who's easier to correct though, phase 1 or phase 3? When people don't have that many problems or that many symptoms, they're very easily correctable. The problem is there's not a lot of urgency that comes there. This is just a simulation so you can see what degeneration looks like. Base of the skull, back of the jaw, beautiful airplane, curve, square bones. So you see how it flattens. See how that top bone is now flat. Bone shapes start to change, hooks come out. So see how it goes backwards? So imagine what's happening to the spinal cord through there. And then see how it all kind of mashes up. Have you ever asked someone and they're like, hey, how tall are you? And they're like, well, I used to be 5'10", but now I'm only 5'9.5". That's literally what's happening. It's loss of disc height. Problem being is that there's a direct correlation. The more height that you lose, the shorter you become, there's a direct increase to your mortality rate. I will show you this. Okay. Imagine 100% of the messages get from the brain out to 100% of the organs. That's life. 0% then would effectively be? Yep. So 60%. So 40% loss of function is the day we experience our first symptom. Though usually when we see a symptom, what do we do with it? Tylenol, ibuprofen, omeprazole. So we continue to keep moving this way. And eventually there's some point where we're like, listen, we've got to do something different. We start getting adjusted, we do our home care, we start feeling great, the symptom goes away. But then usually when the symptom goes away, guess what else usually goes away? Yeah, like why would I still, my sciatic's better and I don't have headaches anymore. Though the problem is often we're still doing all of the everyday activities or we still have underlying degeneration. So unfortunately, guess what comes back? And then when the symptom comes back, guess what usually comes back? Like I remember when I felt the greatest, I was getting adjusted, I was doing my home care. And so somehow we've allowed ourselves to get caught in this system where all we do is chase symptoms. Though the problem with that is it never actually allows for our body to get to and heal at this 100% potential. Like this is always our goal for you. This is Adam's grandma referred him in. Kind of got sucked into the medical merry-go-round. Think about this. If you don't feel good, you go to the doctor, they give you what? If that medicine doesn't work, you go back for the different what? Or the specialist who gives you the bigger and better. And if none of that works, the next step is they want to do what? Yeah, so in our society, how we view health is drug it, and if all else fails, we'll cut it out. And we consider that our what care system? Ear infection, antibiotics, tubes. Spine should be on the solid line, spine's at the dotted lines, and absolutely this is something we can help with. Mom said, yes, but I really trust my pediatrician. I'd like a second opinion. Absolutely. He said it does look like this start to be a scoliosis, so two things that they do. One is the watch and wait technique. If it gets worse, they brace, here to here, it's 23 out of 24 hours. Or they do Harrington rods, which are stainless steel rods where they literally open you up and fuse the rods to your spine. He said, but for right now, it might be some muscle spasms, so I'll send you home with a couple days of muscle relaxers and we'll see you back here in a week. And she said, I'm not putting my 10-month-old on muscle relaxers. So think about this. Why would it ever be that your pediatrician, your neurologist, your orthopedic doesn't say like, hey, do you know of anyone who knows how to help correct the structure of the spine? And it's the same reason why bring me those antibiotics and say, hey, Dr. Leanne, is this for a gram-positive or a gram-negative infection? I have no idea. We studied spine and nervous system. They studied drugs and surgery. So just our solutions to problems look a little bit different. Let me ask you this. Do you think kids need more or less care to have their spine corrected than an adult?
More because they're changing?
Yeah, they fall a bunch more. It's less, though, and here's why. All the problems can only be in there for how long? I'll never see someone who's 5 years old walk in here with phase 3 degeneration, ever. The only difference between phase 1 and phase 3 is what? Time. I have 3 littles of my own, a 5, 3 and a half, and a 1-year-old. And so people ask me all the time if I get my kids adjusted. And I have each one of them since the day that they were born. And really never because they complained about headaches, neck pain, or back pain. Though the great thing about what we do here is we don't just adjust for the headaches, neck pain, and back pain, right? We adjust for the 100% health and healing, and a great side effect of that is that the headaches, neck pain, and back pain go away. You'll see we're a big full family office. We have multiple family member discounts. And it's just really a simple question that we ask, is that if you could make a decision that would radically change the outcome for the health of you and your family, would you make it? So we see families. Okay, last one before we break off. So this is Steve. This is lower back. So it should be nice and straight, level pelvis. Spine should be on the solid line, spine's at the dotted line. Came in, said, I think a lot of mine's just muscle. So we took x-rays, and he has damage on majority of the nerves throughout his lower back. Went through recommendations, finances, and he said, hey, I'm gonna do this. I just need to go home and think about it. I'm gonna come back next week. And so I've realized over the course of time that I'm gonna go home and think about it is just a really nice way to say what? It just means no. People understand teeth more than they do spines. Imagine you have a cavity that you go home to think about. On its, laughable, right? But on its own, does it get better, stay the same, or get worse? Because it's the progression of tooth decay. So guess what happens with the progression of spinal decay? So about a year later, what had started off as some mild lower back pain started to radiate down his leg. If you compress a nerve, that goes up to the organ. That organ doesn't function better or worse. Constipated. That is how your body rids itself of toxins. So if you're not ridding yourself of toxins, guess what's growing inside of you? They oftentimes say intestinal cancers and colon cancers are more man-made cancers. Also slated for back surgery. Does anyone in here know of anyone who's ever gone through back surgery? Are they typically better off? It's the last research I saw was a lumbar surgical fusion following 2 years has like a 75 to 80% failure rate. And I did find out this more recently, a couple months ago. The state of Indiana requires hospitals to be transparent about their shoppable fees. So I was interested to see. A lumbar or thoracic fusion costs $114,000. If it's in the cervical spine, it costs $134,000, according to Eskenazi. And so we probably have, we have dozens of patients with different types of back surgeries, and I'll always ask, if you knew it was such a high failure rate, with such a high price tag, why would you ever go through it? And what's been interesting is that across the board, it's almost been the identical same answer regardless of who I ask. People just want a quality of life. I want to be able to get on the floor, play with my kids and grandkids. I want to be active, retire, travel, stay active, right? Like, people just want that quality. But just like anyone, we start you off more in the beginning. We've got those different checkpoints. Again, after a second set of x-rays, about 7 months. No more leg pain, able to go to the bathroom normally, completely canceled his back surgery. Now, one thing, please don't leave here and tell people that your chiropractors cure back surgeries and thyroid problems and migraines. Because truly all we do is help remove interference so your body can get to and heal at that 100% potential. You know, when we break off, we'll ask just a few simple questions. What do you see? What is it causing? What happens if you leave that there? And do you want to get it corrected? Time and money are typically the two biggest hurdles. Realistically, time-wise, for you to come in to do your pre and post adjustment therapies, to get adjusted, you're looking at about 20 minutes. 3 times a week is 1 hour out of your 168-hour week. Money-wise, it's been really candid to me over the course of the last decade that people have time and money for what they value. We'll have a plan for you. We understand every family situation, though, is different. So if we need to make modifications to that plan, you just have to communicate that with us. Ensure you get care that you need and deserve. For me, I'll share with you just kind of briefly where my passion comes from is that I'm currently at the age that my mom is a good friend. We talked often. We FaceTime this morning. A couple years back, my mom realized she started to develop a hand tremor. So we gave it some time to see if it progressed, and it did. It got worse. So she went to the doctor. She went to multiple doctors who ran multiple tests. Turned out she was pre-diabetic, had high blood pressure, high cholesterol, none of which really alluded to her hand tremor. They put her on a handful of medication. Several months later, she noticed she was having digestive issues. She was having headaches. So she went back to those doctors. Doctors ran more tests, put her on a handful more medication. Several months later, she was really lethargic. She noticed some odd sensations in her hands and feet. So she went back to the doctors. Doctors ran more tests, put her on a handful more medication. And I'll never forget the day my mom called me and said, Leanne, I just don't know that this would be a path that I'm well in 5 years. And so we found our Dr. Maxliving doctor out in Des Moines, Iowa, where she lives. They took x-rays. These are my mom's x-rays. See that reverse curve, fused together bone on bone? That shiny tooth right there is from a motor vehicle accident she was in when she was 17. I think that's what caused it. These nerves are the ones that go down to her hands. She has a scoliosis. Went through with that doctor, and we both came to the conclusion that my mom will likely never see an ounce of correction in her spine. But she said, do you at least think I can make it so it doesn't get worse? I'm like, yeah, absolutely. So just shy about 3 years. My mom started under care. She got adjusted. She did her home care, made nutritional changes. And to date, my mom still has a hand tremor. But at least she's kept it at bay so that she can feed herself. She writes. She maintains a quality of life. But to date, my mom is 10 pounds down and almost medication free. And so for me, not only did I get my mom back, I shared with you that I have 3 littles. The 5 and the 3.5-year-old are boys. If you know anything about boys that age, my house, it all points in times is like a no holds barred WWE wrestling match. And my mom was up the beginning of the year, and she was in the thick of all of it. And she went to go leave, and she gave me a big hug, and I could see just like the tears streaming down her cheeks. And I said, what happened? And she said, do you know if this was 3 years ago, I would have never been able to do this with your kids. And so for me, not only did I get my mom back, my kids have memories and experiences with their grandma that they would have never had it not been for this. So It's easy, life is busy, it's easy to get caught up in the hustle and bustle of everyday life, but life always goes on without you. It's just making sure we have a quality of life while we're here. We want to take care of ourselves. So what I'll have you do is hang tight. Team will be back momentarily. We'll break off, individually go through x-rays, recommendations, any sort of questions, okay?